As a society, we have countless myths surrounding the no longer misunderstood process of pregnancy and birth. Some of those myths are fun, while others lead to confusion and misunderstanding about our biology. Here are the most common pregnancy myths and science behind the truth. Myth number 1. You have to eat for two. Eating for two during the pregnancy is a myth. In fact, there is no evidence to prove this myth. Overeating can result in maternal weight gain and child obesity. Your baby will get everything they need from you for the first 6 months without you needing any extra calories. Once you get the last trimester, you may need about 200 extra calories. Myth number 2. You will have weird cravings. It's a myth. Not all pregnant women have strange and urgent cravings, and here's why. Cravings are often triggered by hormonal changes in your body which affect taste and smell. Also, sharp dips and peaks in your blood sugar levels can give you cravings for sugary, comfort foods. But these hormonal and blood sugar variations are different from person to person. In fact, a lack of cravings doesn't mean there's something wrong with you or the baby. If you don't crave fatty or sugary foods, count yourself blessed. You're better able to make healthier meal choices throughout your pregnancy. If you crave inedible things like dirt, clay, or laundry detergent, call your doctor or midwife. This is known as pica and can be a sign of severe anemia that needs to be immediately addressed. Number 3. You can drink a glass or two of wine while pregnant. A rumor has circulated in the last few years that it's okay to drink a glass of wine when you're pregnant. Unfortunately, since every woman is different and metabolizes alcohol differently, there's no safe recommendation for alcohol consumption. Overuse of alcohol may harm to the developing fetus. Drinking is also cautioned against while breastfeeding since alcohol can get into breast milk. Number 4. You can't be around cats while pregnant. If you're a cat person or have cats, this is a good news. Studies show that contact with cats doesn't increase your risk of getting toxoplasmosis. It is an infection that can affect unborn babies. If you were infected with toxoplasmosis before your pregnancy, your unborn child will be protected by your immunity. However, if you're pregnant, you should avoid cat litter. Parasite that causes toxoplasmosis tends to live in cat feces. It's also recommended that you should avoid stray cats. Have your litter box changed regularly, keep your cats indoors, and don't get new cats while you're pregnant. If you tend to a garden, be sure to wear gloves when working in topsoil or since it can be contaminated with cat feces. If you forget and tend your garden without gloves, wash your hands thoroughly with wash water and soap for at least 20 seconds. Number 5. Can't drink caffeine while pregnant. In the past, pregnant women were advised to abstain from caffeine while pregnant, but recent studies show that moderate amounts are safe, as long as a few precautions are taken. In fact, the American College of Obstetricians and Gynecologists (ACOG) and other experts report that pregnant women can safely consume up to 200 milligrams of caffeine a day, equivalent to a 12-ounce cup of coffee each day. Remember that more than 200 milliliters of caffeine a day can increase your risk of a miscarriage. Caffeine can penetrate the placenta barrier, so be careful not to exceed your limit. Caffeine is also present in many sodas and chocolates, so be extra mindful of them as well. Number 6. Morning sickness is just a morning thing. More than 70% of women experience nausea and/or vomiting during pregnancy. However, this sick feeling isn't limited to morning hours, but can occur at any time of day since it's a result of periodic hormonal changes. For most women, morning sickness improves after the first trimester. But during those first 3 months, there are simple ways to care for yourself. While it might be tempting to skip meals, some women feel better after eating frequent, small snacks of dry cereal or toast or crackers. B6 vitamin and ginger tea are also common morning sickness remedies. Number 7. You can tell the baby's sex during pregnancy. Whether someone told you to check the position of the baby in your tummy, hold a wedding ring over your abdomen and watch in which direction it turns, or gauge the sex based on how active the baby is, you've been told a myth. None of these methods predict the sex of your little one. Instead, An ultrasound can give you physical images of your baby to help you and your doctor figure out the sex. Number 8. You can't exercise while pregnant. Exercising is a good practice for you, your baby's health, and your mental health. If you worked out before getting pregnant and are accustomed to your routine, continue your exercise program once you've consulted with your healthcare provider. Just avoid any new, strenuous activities like holding your breath, excessive bouncing or stretching, sudden jerk motions, advanced abdominal moves, and hot environments like hot yoga. Aim for 30 minutes of physical activity for at least 5 days of the week. If you were not very active before you became pregnant, start with gentle exercises like walking and low-impact, at-home exercises. Number 9. It's not safe to eat fish while pregnant. Maybe you've heard about the dangers of mercury-contaminated seafood, but many types of fish are safe to eat and also good for your baby's development. Eating fish prevents preterm birth and improves neurological development. This is particularly true for salmon, a wonderfully healthy fish to eat while pregnant as it is high in omega-3 fatty acids. Number 10. You shouldn't dye your hair when you're pregnant. While it's a good idea to minimize your exposure to chemicals, evidence suggests that hair dye is perfectly safe when you're expecting a baby. Number 11. Air travel during pregnancy increases the risk of complications. Air travel is not harmful to the developing fetus, and there is no need to avoid flying during a healthy pregnancy. Some airlines may not allow pregnant women on board if they are in their 3rd trimester, because of the lack of adequate medical facilities in case she goes into labor while on board or mid-flight. Myth number 12. Vaginal delivery is not possible after a cesarean delivery. In reality, a woman may be able to have a vaginal birth following a previous cesarean delivery. The decision to give birth via a cesarean or vaginal delivery depends on how the current pregnancy is progressing, the woman's labor, and the risk of any potential complications. Number 11. Heartburn means that the baby will have a lot of hair. There is limited evidence to confirm whether this is true. A small study trusted source from 2006 found that 23 of the 28 participants who reported experiencing moderate to severe heartburn had babies with an average or above average amount of hair. The researchers suggested that this may be due to pregnancy hormones that affect both hair growth and the relaxing of the muscles that separate the esophagus or food pipe from the stomach. Summary. Many myths surround pregnancy, some of which involve incorrect information or advice that may be harmful. A woman should talk to a doctor before making any significant dietary, healthcare, or lifestyle changes during pregnancy. Thanks for watching. Subscribe for more videos.